Thank you for giving us an overview of the problems you have in the health domain. I would give the floor to questions. If there are questions, I have few questions, but I will wait for yours. Yes, there is a question there.
What is in a way the subject of our conference, that is liability and legal liabilities in particular, both under criminal and under private law. Do you consider that this is useless for the purpose of safety? Has it a negative impact? How does it fit within the approaches that you have presented?
I say there is a long debate about this issue. The choice we have done in the industry is that set aside the problem of liability, because otherwise you don't build up a safety culture. When you're looking for liability, you are looking for culpable persons. And these prevent people to report accident, near misses, and you prevent the organization to learn from the accident. I know it is a long debate. Also, in our case, the problem was both know how killing takes place and who is the killer. We make the choice. Let the killer be caught by the police, not by the organization. Keep the organization informed about killing. So if we want to have a learning organization, which learns from its errors, you have to have a space of immunity in some sense. Otherwise, you don't have the stories to tell the people. This is our experience.
I try to give you a political answer. And the blame culture not help to develop patient safety culture. We have demonstrated it in many studies, many experience in the world. And I think that the clinical risk management, the no blame, introduced a no blame culture and has promoted the reporting and learning system. And to promote the learning, reporting and learning system means to improve the condition of safety in our context. But I think that the medical legal approach is useful. Is useful because is connected to the compensations. And I think that the economic costs are very important for our general manager. They don't understand very well the means of human costs and or professional cost, but they understand very well the economic cost. And when I demonstrate to my general manager that we pay more than 50 millions of euro to compensate our litigations, they have a major involvement to improve the quality and safety in our hospitals. This is my experience. This is my experience. And but it's important that to this aspect, for my point of view, it's important that they are separated. Medical, legal, we evaluate the litigation, we evaluate the accident, with our forensics medical doctors. And on the other side, we have the clinical risk management. And we evaluate the accident, but with a very different approach, not a legal approach, but we stimulate the discussion, we stimulate the analysis, but without penal consequences.
Is there any other question? Yeah.
Okay.
Have you ever evaluated fatigue risks as part of clinical risk management as well?
It is one of the dimensions that we consider in the analysis that we conducted with the system approach, for sure. This is one of the strategic points, but it's not the only one. I mean, because sometimes in the previous approach there was a concentration of only the human dimensions in terms of shifts and the human fatigue, which is something very important. But we try to analyze it in connection with the other dimensions of the systems, like the organizations of the work, the technology available for the people, and all these other elements. But for sure, it's one of the main points in the analysis of different accidents too.
Thank you.
Can I add something? Fatigue is both a cognitive, psychological concept and an organizational one. Let's say fatigue is something that make you made an error, for instance, but is due to the overwork. Overwork depends both from persons and from organizations. So fatigue is the typical concept that is both humans in strict sense and organizational as a factor.
Yes, I mean, from my background in aviation, fatigue plays a major role in crew scheduling and pilot scheduling, and here the system taking fatigue into account inside a system when scheduling is a positive and an important factor, and I could see that same being in the clinical arena.
About the fatigue, about the occupational stress. How many hours can work a physician in a hospital? For contract in Italy, about 40 hours. But the reality is different. They work more. And do you think that in the United States, yes, there is a law that established in not more than 70 hours per week the numbers of hours for residents. 70 hours per week. It's necessary a law to establish a limit. But I think that is one of the law more violated in the United States. My friends told me. And I think that is in Italy, in part, is true, also because the economical crisis are reduced the number of physicians and nurses, and it demonstrates that if you reduce the number of nurses, the mortality increases.
Other questions? I have a questions related to your statement about when you said that it takes 17 years before the introduction of any kind of innovation in the health system. It's quite impressive number of years. And I was wondering if a percentage of this is due to the difficulty in managing legal issues. So we saw from the presentation in these 2 days that the legal issues can be a barrier to innovation. So I was wondering if in this time frame, now from your experience, you know it.
It can be for sure, because, for instance, in the introduction of many solutions for patient safety, we got this problem that professionals do not want to introduce some of these solutions because they are related to legal issues. For instance, the management of the clinical record. For years, it has been very difficult to have an integrated clinical record between nurses and physicians, because they were scared of sharing this tool also for legal issues in responsibility related to their work. So for sure, this is a big barrier, especially in these organizations where the blame culture is stronger than a good patient safety culture. So, yes. Okay. The 17 years are related to the introduction as a standard activity in all the different healthcare settings. Of course, the introduction is it can be very in a very short time, but only in some specific context. That's the real problem, to have you know, an introduction in all the different settings.
I think that we must introduce in our context, but some regulations about the usability and ergonomics of medical devices and medical instruments, because many accidents, the cause of many accidents are the low level of usability of this instrument. Do you think, for example, the infusion pump, we have many adverse events for overdose of a very dangerous drugs. And when I analyze these medical devices, I noted that they are not projected. We have any evaluation about the usability. And many of these adverse events, the cause is very difficult interaction, human-machine interaction of the care operators.
And I had also a question for you, Sebastiano, about the protocol that you defined to improve the training in the organization you worked with. And I was wondering if there is any part of this training that you redefined, in a sense, that is devoted to addressing legal issues that maybe you have encountered during your research.
The problem with legal within SAIPEM is a very complicated one, because SAIPEM is operating in different countries, from Europe to Nigeria to Indonesia. So talk about legal issues, it means to enter a labyrinth, math is impossible. And it's too complicated. Instead, we wanted to have a simple instruments that are easy to use for any people inside, from a low-level educated worker in Indonesia up to a well-educated one in Italy. So we set aside this problem, and we concentrated on collecting data, collecting stories to communicate and to improve the safety culture. Let's consider that we don't have just, they don't have, I'm not the owner of the SAIPEM, but SAIPEM is a very complicated, also from organization point of view. They have thousands of subcontractors and contractors, They're following different rules, different work organization. They have just a few rules they are in common, but they are very, very differentiated. I think that they could learn a lot of lessons from people from aviation, traffic control, because they have to do with the same problem with different countries, different culture, and maybe the exchange of information or knowledge between the two organizations, the two sectors, can be interesting for both.
I think that we can close the session, and thank you very much to the speakers.